Good morning, everyone. Wisconsin 10th District Senator Patty Schachtner is my very special guest today, Friday, April 24th, 2020. I'm Ben Dryden. You're watching DrydenWire Live. Thank you to all of our guests this week, Chris Fitzgerald, Adam Jarkow, and Annie Ike, who was on Diane's Kitchen yesterday. As always, you can watch a recording of all of our chats on DrydenWire.com, our YouTube channel, just search DrydenWire, or right here, of course, on our Facebook page. Man, the NFL draft sucked last night. What a snooze fest. With the exception of the Packers' trade and pick, which I think was controversial, man, there were no good storylines. Hopefully my guest today can put me in a good mood. Speaking of, please help me welcome in, for the first time on our show, Senator Patty Schachtner. Patty, good morning.
Good morning, Ben. Thank you so much for having me today.
Oh, of course. Did you? I don't suppose you follow the NFL or any sports or anything?
Oh, yes, I do.
Oh, you do?
And yeah, and you're right. It was a snooze fest. It was that, and I think that we've been so short of having sports that we were all anticipating such excitement that it was kind of a letdown.
I think you hit it on the head. I know. I mean, the Michael Jordan, the Last Dance, I think that was supposed to come out in June, and they moved it up. I mean, holy cow, that was just the ratings that thing had was just insane.
Yeah, and it's so inspirational. And, I mean, you get your, the Tiger King or Last Dance. Which one do you want to watch?
Yeah, you're right. So this is the first time having you on our show, having you on as a guest. So for the people who don't know you, tell us a little bit about you.
Okay, so my name's Patty Schachtner. I am the senator from the 10th District. I was born and raised in St. Croix County in Somerset, so I've lived in this community my whole life. My husband, Joe, and I have been married for 41 years. We have 6 kids and 12 grandkids. We are like pretty much everyone else, that gets married at a young age. We started out with minimum wage jobs, and we were farming and went through, the whole farm crisis in the 80s. When that happened, my husband got a job at Anderson Windows. I went to school to be EMT shortly after that, and both of our careers kind of sent us where we are today. We grew up, both Joe and I grew up in western Wisconsin, knowing that you worked hard and you play hard. So we've always participated in camping. We've done mud trucks, mud runs, tractor pulls. My husband and our sons actually built a twin-engine mod tractor, and we pulled tractors all over with that. Our kids were barrel racers, bear hunters. So we've always made sure that we really live the Wisconsin dream, really. And we have snowmobiles and we have motorcycles, so we do a lot of riding and a lot of outdoor recreation. And pretty much the focus of my career has been in healthcare. But I also understand what it's like to have a small business. My sister-in-law and I had a small wedding consulting business that we ran.
Do you just tell people to just don't do it?
No, let's make it lovely. That was our goal. Let's make it lovely. That I also managed a bakery. So understand with a large corporation, so understand profit loss margins. And also I was the chamber executive for the Stillwater Chamber of Commerce for a while. So my background is very diverse. In 2003, I became a death investigator, and I've continued to be a death investigator with St. Croix County. I'm the chief medical examiner there. So my perspective in a lot of things always comes from the last chapter of the book versus the first chapter. Everything I look at it from the perspective of where we are today and how did we get here, and then try to move forward. So that's a little bit about me.
What's the difference between a medical examiner and a coroner, or are they two different things? Are they the same thing and just a different word?
So that's a good question. Coroners are elected and medical examiners are appointed by the county board. So yeah, it's two different systems, but have they, certify deaths and do death investigations. But yeah, the coroner is an elected position.
So when you say death investigator, I just assume that's law enforcement investigating something, if there is something there. But you're just saying that if anyone just randomly dies, in your county, unfortunately, then you have to be there.
So when you talk about the medical examiner / coroner office, there's different categories when it comes to death investigation. Unexpected deaths is really the big focus, but all hospices are registered with our office, so we always have a keen eye as to what's going on in our communities. And then really the goal is to determine cause and manner. So cause is the heart attack, manner would be its natural.
Okay.
So, and then there's a lot of statistical data that comes through the medical examiner's office and the coroner's office. For example, back in 2007 in St. Croix County, we had 0 suicides. In 2011, we had 18. And so we saw the trend, most medical examiners saw the trend of opioids and the mental health crisis back then, because we were seeing those upticks back then. Oh. And so that's why myself and one of the couple good friends of mine, we created the Suicide Prevention Task Force of St. Croix County. And we trained over 6,000 people in QPR in 18 months to really bring awareness to suicide prevention and what it looked like.
Sure.
So the two of us did that together, and it's one of those things that I'm very proud of. So we have known for a long time that mental health and suicide and addiction has been a huge problem.
Yeah, and it doesn't seem to be going away. How did you get into politics?
So I ran for town board in Star Prairie Township. I ran 3 times, lost all 3 times, but my persistence, the 4th time was a charm for me. I wore them down.
At a girl.
And I did 2 terms on the town board, when it was an eye-opening experience as to local politics and the ins and outs of it, how it works. And, we always, as people, always think everyone, is doing this wrong or this right. And then you get into, especially local politics, and you realize that there's so much more to it. So it was a great experience and a springboard for me. And then after that, I ran for school board and did 1 term on the school board. And then I became senator.
Well, because that's a big jump. I mean, to school board, and then now I'm senator. That's like, Hitler. I think there was some comedian that said this once, that Hitler, nobody liked his paintings, nobody would buy them. Skipping, World War II. Mm-hmm. That's a big jump there. So how did you go from school board president, and then you just woke up one day and said, I'm running for Senate? Why not the assembly first, where you kind of, people asked you to start doing this, and first you're like, no. Did they kind of wear you down over time?
So I was on the school board, not school board president.
Okay.
So what happened, it was a special election, so Sheila Harsdorf had been appointed to DADCAP secretary, and then this opportunity came up. And you're 100% right. A couple of people were calling me, asking me if I would consider it, and I said no 3 times. And then we happened to call our kids, and we didn't tell anybody. My husband and I knew that this here, was an opportunity. And we happened to tell our kids that, this is going on, people are asking. And our son Toby was like, Ma, you tell us when opportunities knock on the door, you take them. And you're not listening to your own advice. So then I was like, oh, crap, they listened to me. That I couldn't believe. And, that was a shocker to find out your adult children listen to. And then after that, it was like, this is a platform that I can really talk about mental health. I know about where the issues were, and it was a short run. It was going from right before Thanksgiving to, January. So The time commitment wasn't that big. I had no vision that I was going to win. I just knew that I was good at being a thorn, and I was going to be really talking about mental health and putting it in the forefront. And I think the more that we talked about it, the more people listened and understood, because addiction, mental health, suicidology, it doesn't know boundaries. It impacts all of us. Mm-hmm. And so I think that was where the conversation really helped for me.
Sure. So you have an election this year. So you have you had an election yet? I mean, outside of the special election and then you're in, have you had another election in between there?
No. So I'm up for election in November. And at this point, I don't have a primary candidate, but we're in the process of collecting signatures and getting that process done.
Yeah, how are you getting those signatures?
So we're doing it primarily digitally. So, we did send out a mailer, but I get a lot of, we post it on Facebook and Twitter and everything, and people request it, and we send it out to them, tell them how to to download it and all that. It's a new way to meet with people, but it'll be fine.
Yeah, and if somebody wants to sign your papers, how do they get a hold of you? Where do they go?
So pattyforsenate.com, or they can go to my Facebook page. They can, reach out to me on my personal Facebook page at Patty Revard Schachtner. I'm pretty accessible. Or call, in that.
So you're in St. Croix County.
Yes.
All right. Did you see Sheriff Walk's post? I know it got a lot of shares, a lot of people talking about it. Some news outlets across Wisconsin had covered that. It's just right next to you, next county. Did you see that? And if so, what were your thoughts?
So I've worked with law enforcement for a long, long time, and in being a death investigator, I'm used to not having judicial powers. So I understand that, the sheriff has the opportunity as an elected official to use his platform the way he wants. I just know that 86% of Wisconsinites and 71% of people in this country are, concerned and think believe in the safe ride home process. So it was an opportunity to have some good, rigorous conversation, and there's nothing wrong with that.
Yeah. So obviously, we should talk about everything, all the craziness in Wisconsin. Huh. Mm-hmm. And that's not the Packers pick last night. That's not what we're talking about. Yeah. Yeah. So just your overall, I mean, I don't know where you want to start, or if you have just some an initial comments on what do you think about this safe ride home order, the first part, and then now where we are trying to look at the ways to get out of the safe ride home order.
So that's a good question. And again, my perspective always comes from a different lens, and I appreciate everybody's different perspectives. I think that's the best way to get the best solutions. So if I do it from the wife lens, I am the wife of a cancer survivor. If I do it from the mother lens, I am the mother of a cancer survivor. So I look at things a little differently. My parents are both alive. My dad is in a nursing home. My mom is at home, and my father-in-law is 92 years old. They're all very fragile, and they, are impacted by other people's actions. So, and I have twin grandchildren that are 6 months old that I haven't held for 6 weeks that live 3 miles away from me. So it's all about choices and really, our own perspectives on things. But at the end of the day, I can isolate myself and I still go to work. I still go to death scenes. I still go into other people's homes, and how I am set up, whether it's PPE or whatever it is, I bring it home to my cancer survivor. So I think about it in a very holistic, in a 10,000-foot lens, because it's real easy for me to say I'm following all the rules, but I am dependent on everyone else following the rules. And a good example of that is last couple days ago, my husband and I went on a motorcycle ride, and we just kind of went around lakes. That's what we like to do. And I was amazed by how many out-of-state license plates were there. So, it's like, okay, so we're all staying at home and following the rules. And now all these out of state people are coming to our area because we're not Milwaukee and Madison, but we are close to the Twin Cities. And there are a lot of people from a lot of different parts of the state and the country that come here for recreation that, probably aren't as cognizant of our stay at home, and what they do impacts us. So that's, my perspective is a little different. So I understand that we need to open stuff up, but what does it look like? What is the plan? And if we have a PPE shortage for our healthcare workers, how are businesses going to get masks and gloves, especially in the food service and there? How are you going to get that so it's safe? And are you going to expect that from your customers? So if you open up, so you already have to take your bar, restaurant, decrease the capacity by 40 to 50%. And then you have to have your staff trained in PPE and, how to maintain a safe environment because you don't want them to get sick. And then everybody that comes in, do they not? So now you're knowingly exposing everybody to everybody else's stuff. And, so it's really interesting to see how this all plays out. And I think, again, my lens comes from a different view because I was there in the front line when the HIV virus came through. I was there when we were, forced to go from mouth-to-mouth CPR, where that's what we did. People literally, you did CPR, they threw up in your mouth, you spit it out, and you kept going, and you didn't wear gloves, and you put your hand right in their blood. That's how it was back then. And we worked our way through it. And it wasn't until I stuck myself with a needle that I realized how serious this virus was, because now it impacted my family, it impacted my husband. I had to go through lots of testing because of it, and it makes you look at things differently. So when we look at this virus, it's an invisible opponent, and we don't know what it's going to do. So just because it's not here, because we don't have enough testing to prove it's not here as bad as other places, doesn't mean it's not here.
We've asked a few guests. We've had Adam Jarko on. We had 7th Congressional District candidate Tricia Zunker on, and we've been kind of doing these grade things. I don't know why. I just kind of started and now we're doing it. What grade would you give Governor Evers in his handling of the COVID-19 in Wisconsin?
I guess I think right now we're all at average, because we don't know what we're fighting. It's kind of like taking your first chemistry class. Yeah, you don't know a lot about it, and you're hoping for a C, and that. Yeah. But it depends, again, what perspective. If you're someone with a very complicated medical history, or have family members that have that, or maybe you have children that have disabilities, you're going to be very happy with the stay at home. But if you're a business owner and you haven't had your doors open, you're going to be very unhappy with this. So again, it depends what your perspective is, and we have to really look at the big picture before we understand exactly what the consequences are, and how we're doing.
Sure. What grade would you give the legislature, whether it's specifically, GOP or Voss and Fitzgerald? But obviously there seems to be some, they're kind of going back and forth right now. I think now they're someone suing someone in the Supreme Court. What grade would you give the legislature regarding this COVID-19 in Wisconsin?
I would give them an incomplete. And they need to go back to work.
I didn't know that was an option. Complete. Well, I love it.
I was a student of the 70s. I tell my kids that all the time. It was the 70s. It was a different time. Incomplete means you need to do more work.
Sure.
And that. So, we have two different perspectives and ideas. But we need to get back to work. I mean, we need to really, people are hurting. But again, you have business people are hurting, and you have we know food insecurity is a huge deal. I've been volunteering at Ruby's Pantry for almost a month now. And I mean, hundreds and hundreds of people are food insecure. And the food insecurity issue was an issue before the pandemic. We just see it better now, how big it really is. And so, when we talk about, we did put forth an amendment to have workman's comp cover our frontline workers, law enforcement, and EMS for should they get that. And it never made it for a vote. We're expecting these people to do this work, but how do you do it if you have to prove that you got sick at work? Most of our EMS and fire around here are volunteers. So, it's a very complicated, and we have to support them. Yeah. When you look at our nurses' aides in nursing homes, we have an elderly population that are at home, and then we have an elderly population that are very vulnerable in nursing homes that are reusing PPE. Using a mask over and over and over again is not a healthy thing to do. Yep. Those are things we have to address. And, how does this impact our local governments? Other issue. Yeah.
Well, and a lot of that. So it all kind of goes together, right? Yeah. So if we look at just we're talking about the incomplete for the legislature and, kind of an average receiver either. So what is it? And you're absolutely right. There's kind of two sides to this. Unfortunately, I think that's kind of it's turned out to like a partisan side. And I'm not saying actual politicians. I'm just saying like just an average person. If I'm a Republican, therefore, I'm supporting, businesses. And if it's your Democrat, now all of a sudden it's no, stay home, stay healthy, which I don't know why they're falling into these two columns, but they just kind of seem to be. So how do the legislature, which you are a part of as well, how do we get this done in a pragmatic, rational, logical, reasonable way? What needs to happen in order for that to happen?
Sometimes I think we all need to be locked into a room together, all of us as legislators, and go through a strategic planning thing ourselves, exercise, and what it is that we want. Because quite honestly, that doesn't happen. And, we need to work together. And it's like, you'll hear all the time, 95% of our bills are bipartisan. Well, yeah, they are, but they're technical. They're technical improvements, changing a word, changing, from noun to a verb. That, that's not effective and impactful. And the last time it was changed was in 1994. I'm like, seriously? You're right. So for that 5% of legislation that is impactful today, we need people to come together, and us as legislators need to come together in a room and problem solve. And take the D and the R and throw it out and go, how are we going to solve this problem? Yeah.
Neither side will probably get what they want. Right. But that's okay. So how has that discussion been had? I mean, in your circles, obviously your center, has that discussion been kicked around? And if not, do you think that will ever happen?
Well, I think that the really it's going to have to happen. There's going to have to be some give and take in all of this because, again, the virus is impacting so many things from the way we live our daily life to the way we spend our money. The unemployment issue is going to be huge. The PPP program is hard on our really small business owners. My son is a business owner. He has a game store. So a board game store. And
hey, wait, I'm sorry. I'm sorry to interrupt. Does he sell chess sets?
Yes.
Okay, what's the name of his business? I'm not.
It's called Gathering Games, but they do. They have all these board games, and then they have game night, and people come and they play, Magic and Dungeons and Dragons and all that there stuff, and they do all this here. But he's also a teacher. He teaches at St. Paul Community College. His partners in the business all have other jobs. So, when we were talking about this, he knows that his business is one of those type of businesses that they can pack it all up for a couple months or a year and then bring it back again. And not all small businesses have that opportunity. No. Some small businesses are operating on a very small profit margin. And as soon as you change something, it changes everything. So when we look at legislation, we have to look at, the whole broad thing of the scope of small businesses, because everyone has a different thing. And if this is your main income, you have a different view on it than if it's not your main income.
Do regional openings, I'm not sure if I'm saying that correctly, but to coming out of the safer home, have you heard about any options for that? And also, is that smart? And if not, why not?
So, I think I've heard about regional openings, but I think when we live in this part of the state in western Wisconsin, because what you'll hear is we're not Madison, we're not Milwaukee, sure. Okay, that we're not. But you know what? Bethesda Hospital is full of COVID patients. They're also building, looking at adding beds at U of M and some of the others. So COVID is there, and if we're gonna, be exposed and have that kind of a hot zone come here, it's going to be coming from that side of the river. It's not going to be coming. We will probably have some exposures from there. So regional says that everyone stays in the region. So that, most of the people over here work in Minnesota.
Sure.
So, and then the other thing is, if you open up business, you go to work. So you go to work, and when you're at work, you have to have a temperature check. And then you get your mask and you get your glove and you go work on your line or whatever, which is happening now. And then you come back here. And now that if, they're saying you're checking good and you don't have it here and everybody here is following PPE and all this here stuff, are you really going to take the chance and go out socially to someplace that doesn't do that? And so even though it's regional, you got to keep your stuff. And what's happening is people are being isolated all over here, and from not passing the temperature check and not passing these things at their workplace in essential business now. So people message me all the time, about what they're going through and how to get resources because they have been isolated. So when we think about isolation and regionalization, that means that we're not going to let anyone in, and that's not going to happen.
Yeah, how?
Right.
How does it look? If you could, wave a magic wand, what would you, again, who knows if this would ever happen, but what would you like to see in Wisconsin over the next 30 days?
Well, I'd like to see some really strong testing so we can actually isolate where the cases are, so that we can have a confident answer that we're doing the right thing. We, again, as the death investigator, I have 6 tests for unexpected deaths. So we have in St. Croix County, we have 600 cases a year. So we as investigators have to figure out who is going to get that test, what parameters they meet, if they meet the parameters, and then you give it, and then, okay, it comes back negative. Great. That's not what we thought it would be. That just means that, we tested the right person. We were able to rule that out. Mm-hmm. If we had mass testing and we were able to test everybody, we would know exactly where it is. And we would be able to say, okay, this part of this region, this is where the hot zone is. Mm-hmm. We need to isolate that. The rest of you, you need to make informed decisions based on how these testing results go. Yeah. So, testing is the key. And without testing, we're just constantly going to be passing through the night. Yeah.
I really like your idea about just putting people in a room. Yeah. Like my wife and I do that every once in a while. Like we'll disagree and the kids will be there. I'm like, that's it. We're going in the room. We're closing the door and we're not coming out until we figure out what, we need to have a unified front here. Neither of us going to get what we want, because usually it means that I want to just order a whole bunch of pizza and she wants to, have a salad, and that's what I'm supposed to eat. Mm-hmm. So we'll argue about that in the room. We'll close it and then we don't leave. And we usually compromise on, I don't know, like a vegetarian pizza.
Yep. No, I hear you. I think having problem solving skills is really important, because again, we have to understand other people's perspective. I don't know. I like to go out to dinner, and I like to go to and socialize. But, if you implement social distancing and all that that totally changes the atmosphere of that outing. So then it's like, okay, how are we going to make that experience enjoyable so that people are enticed to come back? Or, so I mean, we have to really think about the whole picture and take the politics out of it and just go, okay, how are we going to make this work? Because it's never going back. It's never going, and at least not for the foreseeable future.
Right.
So how are we going to change
it? And how do you take politics out of politics?
Yeah.
When you figure that out, let us know. Come back on the show and tell us how that actually worked out for you.
Word.
Yeah. I by the way, I keep going back to it. I've written it down like twice just to make sure I don't remember to kind of look into this after the show a little more. I loved what you said about the 95% of the bills are bipartisan, but a lot of those are just, like changing a word in a document. So I had never thought about that before, and that's brilliant. That's great. What else do you want to talk about that we didn't get a chance to? Do you want to expand on anything or anything you want to bring up?
Well, I think, we are in some real unusual times right now. And we as a society, when we look back on all of this, how we got to the other side and got successful is really going to be judged by everybody. It's going to be judged by the kids. It's going to be judged by the elderly. And, we have to stop saying that, that's just like the flu. With the flu, about 24,000 people die a year with the flu in an 8-month period. We're going on almost 50,000 people dying in 2 months. To say that that's not impactful to us as a society, and that because they're vulnerable adults or whatever, really lessens the value of the people who are dying. I can't even imagine what some of these folks that are working the front lines actively during this COVID experience, what they're going through. And when we think about going back to the beginning of the conversation with mental health and how my career brought me to this place, we are going to have so much more mental health issues because of COVID-19. We're talking PTSD, we're, locally, and there's so much more that's going to come from this. And we barely even talked about our mental health and wellness at the beginning of this session. I mean, it was like we've been talking about it as frontline workers for over a decade, and nobody was really listening. And all of a sudden, these proposals came up like it was like, here's my unicorn. See, I got this great idea. And it's like, no, you haven't been listening about mental health for a long, long time, and we haven't put any money into it. Now we're going to have an issue where we're going to have even more people struggling with mental health due to how we're dealing with this. And we don't have those resources set up now. So as you look forward and what this is going to look like, we have to figure out how we're going to deal with a system that is going to have to increase its capacity for mental health of our frontline workers, meaning law enforcement, first responders, nurses, psychologists, all these people that are dealing with mental health in a way that they never thought they would. And how are we going to deal with it? Because if we don't, the collateral damage of this here is going to be much bigger.
Yeah, I think that's a discussion that isn't being had right now, with the exception of people like yourself who are looking to that future. I think right now most people are looking to the future as in one of the businesses opening like 30 days out. We're kind of looking. But you brought up some great points there about we should. That's all very important. The next 30 days, that's absolutely important. But we should also be looking at 3 months from now 9 months from now, 2 years from now. So we can start addressing that now, or at least just having those discussions right now. But I think that's kind of tough to do because right now it's like deer in the headlight. That's the thing right here. I'm worried about the deer right in front of me, not the one 2 miles down the road. But you still, you kind of have to keep in the back of your mind that it isn't just going to stop after 30 days, like you said.
Mm-hmm. Well, and the big issue is the whole internet and telehealth and broadband.
Yeah.
This here has forced us to go into the 21st century with medicine and practicing medicine, and it's not going to go back. So people with good internet and access and broadband are going to have access to medical care in a way that people that have bad access are not going to have it. The days of having full waiting rooms full of sick people, not going to happen anymore.
Crazy.
You're going to have to go to, you have access to the internet so you can contact my husband's oncology visit is tomorrow or next Tuesday online, his oncology visit. So it's like, this is the future. And if we're not prepared with real investments on broadband, there are a whole group of people that are going to be left out. So I think as legislators, our goal should be 21st century thinking, not going back to the past.
Well, hopefully you don't get sick because it looks like your internet speed isn't very high.
Well, oh, geez.
I'm just playing. Yeah, that is a great point. I know we've had Darren Cox on. He's a mental health professional here in Spooner. A couple of times we've had him on now. And he's doing a lot of things telehealth. And he had brought up that if it's a person that he's been regularly, a client that he's been regularly seeing, it's a little challenge, of course. Like you said, there are some that the broadband isn't there, they don't have access, or they don't have a smartphone. He said, but the other part is you can't really do it for a first-time visit. It's really difficult doing a first-time visit remotely because there's so much in the body language and you just can't see it on a screen. He said he can't really explain it. It's why I'm sure he could. But, yeah, and that just adds another layer, too. Ugh.
Yeah. Well, think about going, to your anniversary dinner to that fine dining place locally, supper club, and the waitress comes up and she's got a mask on and gloves, and you're there to have this, this wonderful experience, but you can't even see them as they're explaining what the menu options are.
Yeah.
And and there's nothing better than having a good waiter explain their food.
Yeah.
And seeing their facial expressions. Well, that's not going to be how we do it anymore if it's done correctly. So how are we going to teach ourselves to be better readers of the eyes, so to speak, because we're not going to see the full facial experience anymore.
Yeah.
So, there's so much that we have to learn.
Oh, right. Yeah, and when I started DrydenWire, it was, we didn't revolutionize like news or how we do it. It was just in a different way, different business model, daily, focused on social media, free content, blah, blah, blah. About 2 years into it, I remember, so I live in Spooner, and we were looking to see who delivers food. And I started thinking, what would be great in some of our small towns is a delivery or pickup only. So that would solve a lot of issues and location, stuff like that. Opening only during business hours or through the evening. So we were starting to come up with this idea. And no kidding, we made it past the brainstorming stage, and we were moving on to strategic planning part before we decided to, pull the pin on it for a few various reasons. But there's a lot of these, as you had mentioned earlier, we're now having to adjust. But we should have probably done this 2 years ago. We just didn't do it. And now we're forced to do it. And unfortunately, we're seeing a lot of these businesses that are struggling when, and I have nothing but respect for small businesses, support them 100%. Absolutely, I'm a small business owner. But some of these, maybe you should have been making some adjustments a couple of years ago. That's all.
Yeah, and I think moving forward in what the expectations are, we have to we can't engage in technology and then say, oh, I'm over here, so I don't have to use it anymore. We all use technology, and we all use technology to make our life better. And technology has to be infused into business models. Yeah. It's very clear.
Yeah. Senator, thank you so very much. This has been great.
Thank you for having me.
Yeah. Any last words?
well, enjoy the weekend, right?
Yes.
And
Last dance on Sunday night. Something finally.
Yeah.
Oh, wait. NFL draft, I guess, again, but who cares? I mean, man, is that boring. Well, you are welcome on, as always, anytime.
Thank you.
So thank you so much, so very much. Maybe in a couple months when hopefully things calm down and get a little closer to the election, we'll have you back on.
Oh, for sure. Thank you so
Awesome.
much again.
Thanks, Patty.
And have a great day.
Thank you. Special thank you to my guest today, Wisconsin 10th District Senator Patty Schachtner. And thank all of you for watching. We'll see you right back here Monday morning. Until then, stay safe, keep your social distance, and have a blessed day.